Hi everyone, welcome to the Aesthetics and Wellness podcast by Dr Yusra. On today's episode, we have Dr Safia Debar, medical doctor with a special interest in neuroscience, stress, and breathwork. We have talked about what stress is, the signs and symptoms of burnout, how to manage and prevent them, and some tips on where to start. I hope you enjoy. Hi, Safia, lovely to have you on today.
Lovely to be here. Thank you.
So for those of our listeners who don't know a lot about you, you are a medical doctor in London. You are on the GP specialist registrar. You have a lot of knowledge in stress, neuroscience, and you run wellness retreats, don't you? So tell us a little bit more about you and your background.
Yeah, so that's right. So my name is Safia Debar. I'm a GP in London, private GP. I have a special interest in the neuroscience of stress and wellness.
Mm-hmm.
I'm a breathwork and meditation facilitator. I run stress management courses as well as retreats. And my style of medicine is more the integrative functional medicine approach. But stress management is the cornerstone of a lot of my consultations.
My God, I feel like I'm going to use this as my consultation. I just love everything you do, everything you stand for, and how you really address health in a holistic manner. Understanding, and you and I have had many conversations about this. And I think we're very much aligned in that you can't treat body without treating and understanding mind. Nor can you treat mind without understanding body.
And my concept of health has changed. Mm-hmm. Having gone through burnout myself, being raised in the traditional medical approach, I now see that it's not enough. Mm-hmm. It's very good at what it does. However, we now need to see a broader view of stress. And so my pillars are really the neuroscience, number one, medicine, number two, and then number three is the semantics. So, it's kind of the soul level, the how we feel emotions, the awareness, that piece, because I find that it's missing. So I think the concept of true health, true wellness has to incorporate all of these facets for it to be effective.
Agree. I always say health is not the absence of disease, but a complete state of physical, mental, and social well-being. And when we're talking about wellness, part of that is conscious and subconscious. So it's your practice as well. And understanding wellness, when patients say to me, what is that? What is the difference? So a lot of people, again, they see health as, I'm healthy, I don't have a disease. Yeah. But actually being well is showing up as your best self and thriving, not just surviving.
Exactly. And it's being aligned to your values, physiologically aligned, spiritually aligned. And I'm not talking, people talk about spirituality, but really it's about meaning and purpose, as well as the kind of the general meaning that we give to that. But it's really having integrity and alignment in all processes, in how we are living our lives, how we are working, how we are showing up, our relationships, all of those facets have an impact on our health.
Agree. So you talked about burnout. Now, I think a lot of doctors don't talk honestly enough about this. And I think the lifestyle of medicine, as you and I both know, actually predisposes the medical profession to being some of the fastest en route to burnout. Can you tell us a little bit about what burnout actually is?
Well, burnout in the context of work is really seen as kind of, there are different ways to looking at burnout. It's kind of the end point after chronic stress. This is exhaustion. This is compassion fatigue. It tends to have been studied in service industries, so caregivers, in that kind of context. So burnout, as the name suggests, is really when
you have nothing left to give.
That's it. Yeah. That's it. And it can happen it can affect us on different levels. It can affect us in terms of our health when our body is telling us, I'm done. It can affect us from a mindset perspective. So compassion fatigue in doctors, in nurses, in anybody that's in a kind of caregiving profession.
And in relationships.
And in relationships, exactly. Exactly. I mean, it can, no one is immune to it. No one is immune to the kind of maladaptive effects of stress, because we have to remember that stress is actually good for us. Yes. Stress is about survival. Stress is about resilience. Stress is about adaptation. So we demonize stress. We're trying to manage and control stress all the time. It's not about that at all.
Yeah. Actually, you need stress in order to run away from tigers and the bad guys. So going back to burnout for a second, can you tell me a little bit about your story and burnout.
Yeah, sure. So my first degree was in neuroscience. I then underwent the kind of traditional medical training and wasn't sure what I wanted to do. So opted for the GP vocational training. So hospital shifts, lots of different specialties. And then did some academic work. So I did a master's in public health and essentially was doing research, 2 clinic jobs, plus nights, and was loving it. I was fulfilled from the career perspective. I was, very driven, ambitious, doing all of that. But I realized that that was all I was doing. I was working, 14, 16-hour days. Literally, I would make jokes with my A&E colleagues. I was like, I just need to camp out in the ambulance bay. Like, what is, and that's fine. But I soon realized that
there's an opportunity cost.
Yeah, 100%. And it was actually a conversation with a colleague of mine. And he said, Safia, how much are you willing to sell your 30s for? And I just went, what? Like, all I'm doing is work. And I'm liking it. But the compassion fatigue was starting to seep in. And randomly, I ended up at Harvard on a mind-body medicine conference. And that really started the awareness for me because I didn't know I was burnt out. All I knew was I was working a lot. I wasn't mindful about anything in my life. And the rest of my life was non-existent, really.
Would you say you were in autopilot?
And I was on autopilot. I was on a treadmill. And it was kind of this after the other. And, in medicine, it's, diploma after diploma. I'm a lifelong learner. I love it. I mean, it really is my passion. But it started to kind of turn into the enemy because it meant the other areas of my life were deficient or deplete.
I really get that. And I think...
And I didn't know.
Yeah.
I had no awareness. And it was only after that I thought, oh my God. It's like when you're so tired and then you stop to rest, you don't realize how tired you were. That it was that.
I think I see this in a lot of my colleagues and I recognize it in myself. And there have come points in which I came close to burnout. And thankfully I have not experienced it because I've kind of really pulled pause on it. And I talk about it like being in a hamster wheel. You've mentioned the word treadmill. When you're in a hamster wheel, you keep going. There's no end. And you are an autopilot. And in healthcare, you go into healthcare because you're a caring profession, caring person. It's a caring profession. It's very much giving. And you do the extra hours. There is no 9 to 5. You and I know that. The rest of the team go home, they sign out, and you're still writing up patients' notes and looking at prescriptions and looking at x-rays and diagnostics and treatment plans. Does not end. And in a way, I think the medical field, this has caused a lot of burnout in the medical profession. And I see a lot of my colleagues who are suffering silently, and then they start to resent their work because of that.
Yes.
And I think with my experience with that is that I always say, nobody turns up and says to me, you need to do this diploma, or you need to go to this conference. You hold yourself to super high standards. And there's this little voice in your own head. For whatever reason, we can go back to childhood and figure out why there is this voice in your head saying you need to do more and more and more and more. And it's until you hear that voice and go, actually, no, I'm enough. And you stop that subconscious pattern of thoughts and take conscious control. And I talk about the power of no. Yeah. Sometimes when you say no to taking on something more on your plate, what you're actually doing is saying yes to yourself.
Exactly. And it starts with self.
Yeah.
everything starts
because you
with
can't
self.
pour from an empty cup.
Exactly. And also it's kind of the recognition of that cup and the recognition of our early wiring, the recognition of what we see as success, the recognition of culture, society, all of those things that have been given to us. They're not ours. We don't tap into our inner wisdom, our inner knowing. We talk about the brain a lot. It's composed of nerves, but we don't talk about the heart. That's also got nerve plexi, the gut. So we have an innate wisdom. We know innately what we like, what we don't like, but we are conditioned. And so we then end up living our life for others or for a kind of a conditioned response that we are unaware of. So the first step really is just to take a step back. And it's hard to take a step back when you are on a hamster wheel. So that really is the kind of, for me, it took me to actually remove myself from my situation and just kind of, and obviously I went into the science and I just thought, wow, here am I thinking, you know, this is happiness or this is success, but is it? If I'm not paying attention, I'm not honoring my own health.
Absolutely.
You know, so it's a super interesting journey. And also, you know, I think that there are just so many parallels in life and with the neuroscience and with the stress response. And but it starts with kind of taking a step back, a non-judgmental, curious perspective and just observing, which is called metacognition, when I can see myself and I can see what I'm thinking. So I am not my thoughts.
So how do you do that?
Well, you just basically step, you know, some exercises that we do on the courses is kind of like if you were to observe yourself. As soon as I'm observing myself, I'm no longer in it.
In myself, yeah.
So you can kind of speak in the third person, for example. So Safia is thinking this, Safia is doing this. And so you start to kind of pull back. So I am not anxiety. I am not shame. I may experience those emotions of what I've labeled as those emotions, but it is not me. So the first thing is just to start observing my patterns, my behaviors. They are all protective. So they were all designed to protect you against something.
This is super interesting and absolutely a really important thing to understand because, like you said, we kind of look at stress as the devil and this thing that we need to avoid or manage, but actually physiological stress is there for a reason.
Yes.
So, and of course, chronic stress is different to acute stress.
Yes.
So can you differentiate the two?
Yeah. So if we go through a kind of a stress response, so we're chatting, super relaxed. Well, actually, no, not we're in our stress responses in that, you know, if you think of stress as a means for being alert, focused, attuned, communicative, and it increases our performance up to a point. So when I say we're relaxed, we're kind of, you know, I would say
we have a cup of tea in hand, we're chatting. Yeah.
But let's just say we're kind of super chill, right? A lion walks into this podcast studio. We want to go into acute stress.
Yeah.
So I want my system to be flooded with cortisol, with adrenaline, my sympathetic nervous system to take charge, because I want my body to get ready to either fight if I think I can, to hide, or to go into shutdown, to freeze. So I want acute stress because it will ensure my survival.
Right. This is the fight or flight response.
This is our fight, flight, freeze response. So that is going to be good for me. That is going to ensure survival of our species, right? So it's good for me. So I either go into fight, flight, freeze, right? And it means I'm still alive, in which case, great, or it's game over. In which case, game over.
And adrenaline, so our adrenal glands, which respond to a danger, be it the lion in the room or the guy with the knife outside, that's great. And it lands very, very quickly. But in modern day, we don't have this saber-toothed tiger walking into the podcast studio, right?
Yeah.
And what often we do have, though, is chronic stress related to lifestyle. And what I mean by that is, and I think in the medical professional, you know, I can talk about the medical profession. We are constantly treating patients. We are constantly holding ourselves accountable. Sometimes there's a lot on our plate. And cortisol is an important hormone that actually starts to take action from the moment we open our eyes to get us into function. So it's an important hormone for function. But a heightened state of chronic cortisol, where there isn't a letdown or a time to come out of your heightened brainwaves, what happens there?
Exactly. So in order to know what happens, we need to know about our stress cycle. We need to know that we go up in stress. So either real stress or perception of stress. Either way, it's the same.
Same physiological response.
Same physiological response. It's a lack of safety, right? I go up in stress, and then as long as I can come back down in stress, hit my baseline, then I have completed that cycle. So if we survive a lion, then we will then have that knowledge of, wow, we can do it. You know, that resilience of I bounce back. I'm good. I can do it. So if another one walks in later on, unlucky podcast studio, but if another one walks in, we're good.
Yeah.
Or at least we think
you've learned I can deal with this.
So I have memory of being able to have overcome this. Same with a failed exam, same with a breakup, same with a broken heart for whatever reason, all of these things. So it's important to experience the full cycle. That is good for us because we've mopped up that adrenaline and cortisol.
Got it.
If the stress is relentless, the threat is relentless, if I perceive the inability to cope with it, or if I am unable to tap into my active relaxation strategy, then I am then heightened. So if I was a car, I would be revving the engine the whole time. After a while, that will lead to wear and tear. And it will start to change the function of our brain. It will start to change the anatomy of the brain. It's kind of like, you know, if you have a car, the way you drive it will affect your brake pads. It will affect, I mean, I'm not a car person, but, you know, the way we use that response will then affect the effects it has on our physiology.
Yeah, because when you're stressed as well, and you've got adrenaline and cortisol, these are neurotransmitters as well. Noradrenaline? So the first thing that happens is the sympathetic nervous system will then release adrenaline and noradrenaline, and this is available to us straight away.
It's
a quick dump.
It's a quick dump, exactly. So that's why we get that first wave, right? And this is pounding heart, blood pressure goes up. You know, I mean, we can talk about all the physiological changes, and I like to kind of go through them on a system so that we know, you know, so that we think, well, my thinking starts to become more negative and catastrophic. This is good for, if a lion walks in, I don't want to be curious about his eyelashes. You know, I want to be like, oh my God, I'm going to die. So my thinking becomes more narrow. It becomes more judgmental. It becomes more catastrophic.
You go into decision mode.
And do we? Because essentially our limbic system, so this is like the three main structures of our limbic system: amygdala, hippocampus, and hypothalamus. So I describe them as the amygdala is the kind of emotions.
So these are, for people who don't know, these are the parts of the brain.
Yes. So if we think of the area of the brain that lights up with a threat, then this is it. Okay. So if that's if that button has been pressed, then those structures are upregulated, which means that our prefrontal cortex, which is the center for executive decision making, of attuned communication, of emotional regulation, of focus and planning, is down-regulated.
Got it.
So the decisions the decisions we make under stress are not coming from a regulated place necessarily.
Got it.
Okay? Yeah. So we need to know that actually when I'm in stress, that's not the time
to make a logical decision.
Exactly. I have no access. You can almost think it's kind of like
shut down
airplane mode. Right? So you can't really, if you were a phone, it's airplane. Right now. So don't think you're going to try and write a long text. Like it's not happening. So if I know that about myself, then I'm more into the body. I'm more into the effects of those neurotransmitters and of cortisol. So the first thing is adrenaline, noradrenaline. And then we get a signal to the adrenals of, can we have some cortisol, please? That takes about 20 minutes. So this is why when we stress, sometimes we have that acute bit and then we have another wave 20 to 30 minutes later. So that's what happens. When the threat goes, then they are mopped up and we switch from being led by our limbic system to being led by our prefrontal cortex. So then what happens is I start to open up a bit. I want to story tell. I want to tell you about what happened. So
this is when the acute stress is gone.
The acute stress is
gone. The danger isn't there
anymore.
The
danger is gone. So now I'm switching into my relaxation mode.
And processing.
And storytelling and being more open and communicating. My heart rate goes down, my blood pressure goes down, my blood sugar levels regulate, my hormone levels start to kind of, take care of themselves. My gut wakes up, my reproductive system wakes up. The most important thing, and one of the main reasons I do this work, is when I am in a state of stress, my immune system is inflammatory. It's going to be reactive. It doesn't care about the virus or the cancer cell. It cares about now. So right now, I need to be inflamed. I need to almost be toxic. So if a lion takes a bite, I don't taste good.
Got it.
My blood is thicker. So if he takes a bite, I clot quicker. So that inflammation is good in the short term. But if I don't switch it off or allow recovery, then I have persistent inflammation.
Okay, so let's talk about totally fascinating, and I think it's so important to understand actually what is going on when you are in chronic stress, because I think a lot of people think, yeah, but I'm fine.
Yeah.
Especially CEOs of companies, high functioning people, those who are in positions of authority who need to kind of be constantly making decisions, have a slight lack of awareness of what that can do up until burnout hits.
Yes,
up
exactly.
until there is the outcome of chronic stress is burnout. Then you become conscious of it. But up until that point, they are still on autopilot.
Yeah.
And actually, if they recognize what this does to their body, like the impact it has on inflammation, like the impact it has on our ability to make decisions long term, like the fact that it can increase our inflammatory state, so we become in a pro-inflammatory state, and that has an impact on our gut health and our gut microbiome, and that in turn has an impact on our hormonal health. All of it is everything is related to each other. So when it comes to patients who are in chronic stress, what is the first sign, would you say, for them to kind of recognize that they need to do something about it?
We're all very different. We're all the same, but we're all different. So what chronic stress will look like to you will be different to what it looks like to me. What I tend to do with my patients is we just start with the lowest hanging fruit. So how are you feeling? And stress will affect every single system of our body. So if, for example, they're coming to see me for a medical screening, or whether it's stress related, I tend to go with the pillars. So the neuroscience, the medicine, and then the somatics. So what does this look like? How is your thinking generally, right? How is your general mood? How is that kind of, that system? How is your body working? So then we go through the cardiovascular system. Any problems with high blood pressure? Any problems, any cardiovascular issues? How is your breath? I love breath work. So how are you breathing? How is your gut function? Right? So we know that the gut is highly innervated. So if our nerves are always in the sympathetic, then our gut is going to show that. So how is my gut? How is your reproduction?
But when you talk about gut, do you mean how often they're going to the toilet?
The whole thing. So how do you feel? If you think of your gut as an ecosystem, as a it needs, in order for the gut to function optimally, it needs the vagus nerve, right? So, and the vagus nerve, the longest nerve in the body, is the kind of relaxation nerve, right? So if I'm eating super quick, if I'm just, if I'm kind of moving quick, how is my gut going to digest, absorb the nutrients I want, excrete the toxic products? How is that system happening? So am I bloated? Do I have chronic pain? Am I able to eat everything? What are my food choices? Do I have any cravings? So it's, yes, how often do you go to the toilet? But how is your gut feeling? And most of us, if you ever have had an acutely stressful situation, we say we've got butterflies in our tummy, or we need to go, you might have diarrhea, or, if you're giving a big presentation, or all of these things will affect our gut temporarily. But how is our general functioning of the gut? How is your general reproductive system? How are your hormones working? Everything is intertwined with each other. So when you're assessing chronic stress, is there any wear and tear? Are there any signs of wear and tear? And like most people, we either are acting from a zone of inspiration. Oh, I just really want to do better. Or most of us, it's when it's desperation, or when we've hit threshold, or when we're faced with a diagnosis. So if we go through each of our bodily systems and looking at how is it working, that's one. So that's the medicine. How is my mood? And then I look to, is there active relaxation going on? How is my sleep? Am I able to, people call it mindfulness, but am I able to be present in the moment? Sleep. And then, am I taking care of myself? Am I engaging in things that serve my body? Not for weight loss, not to look a certain way, not to be perceived a certain way, but really, nourishing foods, nourishing behaviors, nourishing relationships, all of those things. And so when you start to kind of map it out, you start to get a picture. And then finally is, who am I? Which is like the existential stuff, but super important.
Yeah.
Am I living according to my values? What are my values? Who am I?
So this is integrity.
This is integrity. This is alignment to yourself. But most of us don't even know.
Agree.
Because we're living somebody else's life. We're living a role. We've lost that connection. So you see, it's kind of, and so chronic stress might simply look like sleep. I'm just not sleeping well. Or I'm not bouncing back like I used to. Because remember, stress is cumulative. So we might be fine in our 20s, fine in our 30s, et cetera, but it's adding on, right?
So in your practice, what kind of spectrum of patients are you seeing? I take it you see a range of patients who are either reactive or want to show up as their best self or have come to you after a cancer diagnosis. What is the norm?
So the beauty of GP and the beauty of medicine is there is no norm. But I tend to see a lot of executives. So I do executive health. So
unsurprising. Yeah.
A lot of executives, but really everybody. So from pediatrics to, but everybody. And it can range from, chronic health conditions, lots of symptomatology, diagnoses, because, we obviously do a lot of testing. But often, drawing from my own personal experience, it's kind of like you don't know what you don't know. So really the first thing is awareness and education and empowering and being like, this is how your brain works. You don't even try to go against it. It's gonna be difficult.
Yeah.
It's impossible.
Physiology. It's normal physiology.
Go with it.
Yeah.
Go with it. See what it's, and all these behaviors and thoughts and processes that you're not liking about yourself. They started as protective mechanisms. Your body's trying to help you. It may not be serving you, but that's the ulterior motive. It just wants to keep you alive. It wants to keep you connected. We are wired for survival. We are wired for connection. We are wired to be seen, to be heard, to be validated, all of these things. And we need safety. So when we start to come away from that, then our physiology is like, I'm in a state of stress. So let me flood my system. So then we have a disconnect with what I'm thinking and what I'm feeling. So then we go into either we suppress it, or we repress it if it's subconscious, we distract ourselves, we escape. And these can look like the highly functioning, successful person.
Agree.
So the behaviors themselves are the last bit. The symptoms themselves are the last bit. Let's go to the root. If you are aligned and you are highly successful because you're fulfilling your purpose and you're in congruence with yourself and everything's great, perfect. But if you are doing it from a place of lack, of scarcity, of fear, then you're inflamed. It's inflammation.
And when you are in a state of chronic stress,
yes.
To what extent do you feel that is a precursor for long-term illness or disease?
To what extent? Like the maximum,
it's a huge
everything
precursor.
Starts in the brain. If your brain is in a state of stress, it is not in a state of growth and repair.
So conversely, to what extent do you feel that stress modification or management can positively impact health?
Huge. It is health.
So if somebody comes to you with, for example, a cancer diagnosis,
yes,
what do you do? Talk me through that journey.
So again, I like to structure kind of my approach, but we deal with the medical aspect first, right? And then we kind of start to go into the feeling. So this is where people are like, but hang on, you're a medical doctor. how we process our emotions, how we process our feelings, how we process our grief is huge.
Totally.
Because if you think about that cancer diagnosis, and obviously cancer is multifactorial, it will be related to, it has a genetic load, it has a lifestyle load, it has, there's just so many facets to it. But fundamentally, if you have that diagnosis, then what we know is the immune system has been in a state of stress, or the immune system has lacked the ability to detect those cancer cells and to destroy them, right? Because our cells are forever multiplying and rapidly multiplying. So we always have a few dodgy cells, always in a state. But it's our system that then is able to detect them, and a process called apoptosis then happens. So it's just like programmed cell suicide. It's kind of like, I recognize that I'm dodgy, so I'm out, right? Yeah. So if I'm in a state of stress, I can't do that because I'm busy with the kind of the acute moment. So autoimmunity, cancer, diabetes, metabolic issues, everything.
Totally
everything is going to be not necessarily 100% causally related, but you can see, it's like my brake pads. How are you driving your car?
So, I mean, I really, really relate to this because I have an autoimmune condition that thankfully is in remission. I haven't suffered with for many years because to be honest, I was diagnosed when I was 19 and probably at the most stressed point in my life. And the moments in life when I am in a heightened state of stress that isn't acute and maybe lasts a little bit longer because of lifestyle or workload or whatever else, family life, I can feel that my body is going into this physiological state of inflammation and I'm starting to get joint pain. And because I've been there where it's been so bad and I really don't want to get to a state where I can't dress myself. And that's where it was. I couldn't dress myself. I couldn't shower myself. I couldn't literally put my own clothes on or take my clothes off. I'm so conscious of lifestyle modification and boundaries and capacity and what I say yes to and what I say no to in order to keep showing up as my best self, not as the rest of me, So I think stress is a huge part of it. And there's a really interesting book written by a wonderful author and physician called Debar.
Yeah, I love him.
When the Body Says No.
Yeah.
And he talks about his experience in dealing with patients with chronic stress. And often it's the high functioning, strong, so to speak, women who are taking on a lot and have from a very young age have learned that that's what they kind of need to show up as and that's their role, but they're not robots and there isn't that outlet or that downtime. And so they're storing and storing and building and building and building until the body says no.
Yeah, exactly.
And it's a really, really common thing. And it can happen to any patient from any walk of life. But I see it a lot in patients who are high functioning or in executive positions or who are taking on a huge amount of stress either in the workplace or at home.
And also taking on other people's
this is it.
Responsibilities, other people's emotions, other people's everything.
Yeah.
Just feeling, it's kind of like I'm responsible for knowing what you are responsible for and knowing what is in your control is actually kind of this much. But we learn very early on, don't make mommy feel bad. Oh, really? So I have the power to control your emotions. Okay, so let me take that. And, be a good girl, be a good boy, or all of the things that, that are conditioned within us from not necessarily a bad place.
Absolutely,
this is kind of a generational, cultural, societal, this is...
Yeah. There's no manual for parenting, let's just be honest.
Yeah, my manual is just be present and look after yourself and model what you would want in your child. And so it's kind of, it goes against the, self-sacrificing martyr of a mother that would just kind of, it's so interesting. And you can always come back to the physiology and to the science.
One of the biggest things, I think, having read a lot about this subject, that can make a big difference on your management of just life in general is emotional regulation.
Yes.
And if you can model that to your child, then you are winning, really. Now, that is conscious. That is a conscious effort. It's kind of like I say it's like exercise. You've got to train yourself to get to a point where you can emotionally regulate. And you don't expect a 2-year-old to be able to emotionally regulate.
No, they can't. Also, you have to follow the kind of neurodevelopment.
Absolutely. Yeah. So as an adult, you hope to get to a position where you can regulate, right? And that's what you want to model to your children. And be there when they're not in a state, when they can't regulate. You know, you're the pillar of strength. Now, with that comes it's a conscious decision. It's a conscious training. And I think there's something to be said about this conscious effort and conscious thought that goes into behavior, and also this bi-directional relationship between the conscious and unconscious mind. So let me go dig a little bit deeper here. We know that when there's a saber-toothed tiger and we're in stress, or work is stressful, or you're in a stressful relationship, whatever, this is something that's going on in your mind, but there's a physiological response. So adrenaline is pumped, cortisol is pumped through your body. And when there's somatic changes, one of them is your breath, your heart rate, your sweat, etc. However, if you're conscious of it, then the few things that you can control is your breath. You can be like, okay, I'm finding it hard to regulate here. I am stressed. If you're in the state where you have this metacognition and you can observe yourself and you recognize the signs and symptoms of the stress response.
Yes.
And then you say, okay, what can I control here? One of those things is breath work. Yes. And by using breath, you can then have this positive response on your mental state. So it's bi-directional.
Yes.
And this is one of the things that you teach in your courses.
Yes.
So talk to me about that.
So it was only when I experienced breath work and when I looked into somatics that I was like, what are we doing? The breath, it's the first thing you do when you come, when you arrive in this world. And it's the last thing, the inhalation.
God, when you say it like that.
First thing you do.
Yeah.
Last thing you do.
Yeah.
And then in between, there's life. As children, we know how to breathe. It's a diaphragmatic breath, and we are shifting air. But soon, we realize that I can't control the world around me when I'm 5, when I'm 6. But what I can control, if something is overwhelming outside, is I can hold my breath. So then that becomes a state of I have some ownership, some control over my breath. And then I'm told, sit up straight and tuck your tummy in. And then, so then I go into a pattern of breath, which is kind of either I'm holding it or I'm breathing shallow. But essentially the breath becomes a conduit for me dealing with the emotions around me. So if we hold our breath, we're also holding that energy of the emotional state, right? And we swallow it. So the breath becomes our conduit for holding and managing and controlling, but it also conversely becomes the means by which we can release. Yeah. So we need to understand what is emotion. I always describe it, it's just a cocktail. It's a cocktail of adrenaline, noradrenaline, a bit of cortisol, a bit of this, a bit of that. And it's the change that you have in your body. But often we start to disconnect mind and body so that we're not even tuned in. I remember one day in clinic, I always tell the story, I ate a banana, right? And then literally 5 minutes later or 10 minutes later, I was like, oh, I have that banana. And I saw that I had eaten it, but I had no recollection of having eaten it. So we can just be so disconnected that we're not talking the body's language. And if you think of the proportion taken up by my head and the rest of my body, I'm completely disconnected. So if I'm disconnected from my breath, then I'm disconnected from the ability to release that emotion. So we're not trying to regulate. Regulation is kind of the outcome or the process. I am allowing what is. To pass, to be experienced. Okay. I'm surrendering into the feeling or the physiology. It's like if you go to the gym and you're panting or you have cramp, it's just allowing it to move. Yeah. Energy is, emotion is energy in motion. Allow it to pass and it does its thing and then it's gone.
So we teach this to our children, is sit with their emotion rather than
Yes,
try
if
to
you
mask
can
it.
learn that,
If you can learn how to sit
you
with
can
it.
you can do life.
Yeah.
If you're feeling grief, if you're feeling sadness, and if you're feeling joy, you know, by shutting down our stress or by shutting down our sadness, we are also start shutting down our joy.
So it's a feeling fatigue. Forget compassion fatigue. It's an inability to
because
actually
we don't
feel.
know. We're not taught it. Because if you think about it, you know, a tantruming child is loud. It takes up space. It's kind of embarrassing. It's all of this. It's noise.
Yeah.
But all they need is to be allowed to go up.
Absolutely.
And then to come back down.
Absolutely.
I mean, I always used to use a timer with my daughter and be like,
2 minutes and then you need to snap out of this.
No, for me, you know, like I just be like, okay, breathe. How long is this going to last? And I think the maximum was like 18 minutes, you know? So, but we're not taught that.
I agree with you entirely. We're not taught that. And I'm very lucky because my husband is a child and adolescent psychiatrist and he has this incredible patience. And I've learned so much from him about how to deal with children in various different emotional states.
Yeah.
And the fact that they can't regulate.
They can't. We have to be their prefrontal cortex.
Absolutely.
Yeah.
So when they are sad or angry and unable to communicate, they don't have the ability to regulate.
Yeah.
And sometimes to communicate that.
Yeah.
And if you say to them, enough, end this, what is that going to do? You're actually forcing them to mask it. They don't feel safe. So you're creating a position of the sensation of danger. And then that impacts trust. And they still can't regulate. So
you're saying these emotions are not welcome.
No, they're not valid. Yeah, exactly.
They're not valid and they're not welcome. You shut that down.
Yeah, absolutely.
You know?
So now, so now I'm really conscious of that. And if my daughter is sad, and I remember once I came home and she was having a total meltdown. And I'll tell you why she was having a meltdown. She was having a meltdown because she was eating and she thought, because I'm eating, I'm going to grow up because food is going to be, is going to nourish my body. I'm going to grow up and then I'm going to lose my teeth and then I'm going to become an adult and life as an adult is hard and I don't want to be an adult.
I don't blame her.
And so she was having this total meltdown and she's like, I don't want to be an adult. And I'm like, okay. And she's like, but I'm hungry and I have to eat. But if I eat, I'm going to grow up. And there's just no rationalizing with that. And I was like, it's okay. I totally get it. And I'm holding her and I'm just allowing that emotion to pass. And of course, for me, it was a little bit comical at the time. But these are tools that we have to develop so that we can also pass them on.
Yeah, because listen, you have to speak the body's language. And children are a lot more tapped into their intuition and a lot more tapped into their body until it's conditioned out of them. So if you're holding a baby and you're stressed, the baby will pick up on that.
Yeah,
so we have mirror neurons. It's energetic. If I walk in and I'm smiling, you're more likely to smile. If I'm looking at you, kind of like, we are interconnected. So our nervous systems are communicating and they don't communicate
verbally only.
Verbal. You have to start to speak the body's language. Yeah. And our children and if you have access to any children and just watching them, if you watch them, and their emotional waves and how they, they'll be jumping for joy and then they'll be crying and it's just amazing to watch. But we don't do that. We are trying. And it's not to say, you're in a boardroom and you're super stressed and of course you can't punch people in the face or of course you can't always run away but it's just knowing that, okay, these emotions have an energetic load and my only job is to be able to create the space for me to release. So I can release through the breath, I can release through meditation, I can release through exercise, I can release through sleep, the list goes on. But I can't release through the mind. I can't talk myself out of an energetic state.
So that's really interesting. So because I feel like there's a second episode of this podcast coming up, but I'm conscious of time. And I think breathwork is a huge thing. And actually people are conscious of breathwork. And I think people can understand breath as well. Yeah. And I use this almost every single day, actually. And I think this idea of the conscious mind and conscious thoughts, metacognition, but taking control of what you can take control of. We're taught it when we're giving birth as well, breathwork, right? And to breathe out and for your breath out to be longer than your breath in. Yeah. And I do this with my patients every single day because I am injecting them and they will come with fear and nervousness and have a physiological response. And the first thing they do is,
exactly.
They're holding their breath and they're clenching and they're tightening up. And, that is a recipe for feeling more pain. So I am coaching them on their breath.
Yes.
And this continues throughout the entire treatment. Lo and behold, they finished and they've forgotten about it. And that's the power of the breath and the mind.
Yes.
Because it's bidirectional.
Yeah.
So that's something I think a lot of people can understand.
Yes.
But can you, if we're wrapping up here, can you give me a few pointers that our listeners can take away of how to release? What stress modification, lifestyle practices can they do to optimize themselves so that they continue to live a happy and healthy life?
So I always say, to go big, go small.
Okay.
So I don't want to add on to anybody's to-do list. I want you to start embedding into your own day-to-day. So you're brushing your teeth, be mindful with that. Start to bring awareness into your day-to-day, even if it means today, this is my pattern. This is what I do in a day. Then, can I start just to take some mindful breaths? Just to be aware of the flow of the inhale and then the exhale. How am I breathing? Do an audit on your breath. So how am I breathing? Without trying to change a thing. How am I breathing? Because that presence, that awareness already, you've come out of you and you're observing. So
I'm observing now. I'm definitely not doing a diaphragmatic.
Yeah. So now we're talking. So there's a bit of, we're kind of, there's a little tension.
Yeah.
But if we were just to stop and take a breath and just kind of, you need to start talking your body's language. So what is your body's language? It's the breath. Number one. Can I start just 2 mindful breaths a day? Very easy. Every time I do something, so every time I call a patient in, I will take a breath. When I'm examining them, I will take a breath. When I now examine, I always put a hand on their abdomen and ask them to put one on their heart. And I just go, okay, let me see how you're breathing. And then you see that kind of, So, and then I'm doing that at the same time. So take your day, your individual schedule, and start to embed things that you are doing already. Washing up, brushing your teeth, shower. That's number one. So just start to inject.
But what are you supposed to be doing? While you're brushing your teeth, you're not thinking about your to-do list. You're just thinking about brushing your teeth.
You're just going, so you can kind of absorb yourself in what is happening. So if this was the last time I'm brushing my teeth, or if I had to describe this to an alien that's never brushed their teeth, how would I go into what I'm feeling, what I'm tasting, all of my senses, what I'm smelling, the noise of the toothbrush? 1 minute. I open the fridge, let me take a breath. So it's going to take a bit of activation energy. So because we're kind of bringing more awareness to it, but just start to embed. And there are...
Okay, but scientifically, what is that doing?
Scientifically, when you start to become present with something, you are engaging in your relaxation response. So if you're taking a breath, you're kind of giving that vagus nerve a squeeze. So it's automatically reducing the tension. It's automatically releasing, mopping up some of that cortisol and that noradrenaline. You're more present. You're not in autopilot because all of a sudden I am brushing my teeth, right? On your commute, look at, just start to observe what's happening around you, and you can do those breaths. People always say, I don't have time, Safia. I'm like, okay, well, how'd you get to work? What do you do before bed? Start to bookmark your day. A bit of, 2 minutes in the morning. If 2 minutes is too much, 1 minute. If 1 minute is 1 breath in the morning, 1 breath in the evening, mindfully breathed. That's one. The other thing the body loves is movement. But going to a gym, all of that, you need 2 hours out of your day. So just a bit of music and just start to kind of loosen. Just a little movement, a walk, just to start to bring awareness into your day so that you are not that hamster. And then I would say, if you're looking at the hard hitters, right? So if you're thinking about what is the one thing, I would prioritize sleep, I would prioritize the breath, and I would prioritize exercise or movement. Because movement brings... flushes our brain with BDNF, which is essentially growth factor for the brain. It loves it and it does the work for you. So I would say those things.
I like
and you know, just bringing back laughter, you know, because when you're laughing, you're automatically breathing deeper, engage. So just to start to bring that joie de vivre back into your day, you know, and just starting with the tiniest things. And we can go into the neuroscience of habit formation and all of that, but it's really just from an awareness perspective.
Thank you so much.
You're very welcome.
I love that. Can I ask you one last thing?
Of course.
If you could tell your younger self one thing, what would that be? I would probably say you are enough as you are, you know, and learn about your brain first. And question, that's one thing. I'm giving you 3 things. Question every belief you have. Question, and do not, and the 4th thing, because I'm now looking into bridging the neuroscience of intuition and logic. So I would go, know what your gut instinct is, know what intuition is, and try it out. There's a lot of science behind intuition.
A lot. It's my passion project.
Okay, so we've talked about stress and what it can do and how it can feel, but what's actually happening on the brain from a perspective of neuroscience? Yeah,
so if we simplify it in terms of what you need to know, if you imagine you have 2 operating systems, okay? We've got operating system A and operating system B. These are served by 2 distinct areas of the brain. So operating system A is coming from the prefrontal cortex, or is led by the prefrontal cortex, which is just behind our forehead. So this area is to do with emotional regulation, executive decision-making, planning, focused, attuned communication. That's 1, or A. System B is our threat response. Okay, so this is made up of the amygdala. This is our emotional center. The hippocampus, this area is like our memory. So it reminds us what course of action led to which outcome. So it reminds us, oh, remember last time you walked down that alley, something bad happened, so don't walk down that again. So it's kind of our memory and what linked what to what. And then number 3 is the hypothalamus. I call this like the bartender of the brain. This area is literally responsible for hormones, production, neurotransmitters. It's making your cocktails. So we have 2 distinct operating systems, me in stress and me in relaxation. When one is on, the other is down-regulated, and vice versa. So you can't be in executive function and... Yeah, you can't be in 2 places at the same time. Got it. They communicate, but if we're going to just simplify it, you're one or the other. When one is on, the other is an autopilot. So I can't make the best decisions when I'm in a state of chronic stress. But is there actually damage to the brain? Does the brain... So we know that neuroscience means that actually the way that the neurons fire can change over time. Yes. And actually the makeup, the actual anatomy of the brain can change over time in accordance to external factors. Does that happen in stress? 100%. So we have neuroplasticity, which is the kind of malleability of the brain. We're always told that, you know, neurons that fire together wire together. So if I'm repeating patterns, then my brain starts to strengthen those patterns. So what we know in chronic stress is our amygdala, the emotional regulation bit, or the emotional center, becomes more reactive, becomes bigger. The hippocampus, which is related to memory, consolidation, learning, starts to shrink. So we can observe through scans, through PET scans, that chronic stress affects the brain structure, the anatomy, and the size of these structures. Conversely, we know that meditation, you know, they've done beautiful research in Harvard on the brain, on meditation, yoga, etc. We know that it increases the volume of the prefrontal cortex. It reduces the size of the amygdala. It reduces the reactivity of the amygdala. So yes, there are significant changes. We can have neuroplasticity for good, but we can also have something called malplasticity. So that we, especially if we are used to states of anxiety, then that can almost become our norm. So if we're used to cortisol pumping, it's like if you're used to being in a club all day or in being in a very noisy environment, when it's quiet, that can actually be threatening.
Got it.
So when we're starting either with breath work or with meditation, we need to see where we are, because that can sometimes be quite jarring.
So what's the difference between meditation and mindfulness? Because mindfulness is being mindful, being present, basically.
Yes.
Right?
So I see mindfulness as a huge, massive umbrella term. Meditation is also a huge, massive umbrella term. Fundamentally, we want to be with what is. So I want to be fully present in terms of my emotional state and my body, and I want to be connected with my body. So mindfulness is I am present with you. I'm not thinking about something else. Or actually, we're not in the, we can think, when people are like, empty your mind. I'm like, no. We don't need to be emptying our mind. We just need to be observing and not clinging on to thoughts. So it's that kind of state. There are so many different types of meditation practices, but fundamentally it's attention regulation. Number one is where I want to focus, I focus. And it's the process of focusing, then bringing the mind back. That to and fro. That's the first step. Once we are able to master that, it's like exercise. It's like, I always say it's like if you're practicing a plank, you're always kind of, okay, am I engaging this? Am I doing this? You're thinking of your form. But once you know how to do that plank, you can then move one leg, do this, do whatever. So similarly with meditation, once we are able to regulate our attention, we can then, and this might not make sense, but let it go in order to receive insight. So meditation is a kind of a practice. Breath work is different because it's being with your breath, and it's more about seeing what is and emotional release.
So you and I have spoken at length at various times over the last couple of years about this.
Yes.
And about waves, brainwaves, delta, beta.
Yes.
Talk to me about that.
So we have different brainwave patterns to mirror different states of consciousness. So for example, we're alert, we would be in a beta state. And we can test brainwaves, like you can do an ECG to check the heart. The EEG machines will check our brainwaves. So we have 5 different brainwaves, and they will each induce a particular state. So we have brainwaves that, like when I'm drifting off to sleep, I will be in a certain brainwave pattern. We have kind of a relaxation state brainwave. And then when we go slower into the brainwave pattern, so when we're going into delta brainwave patterns, these are conducive to healing states of mind. So this is almost like you're saying to the immune system, polish the silverware, clean up, do whatever. And then this is super interesting, but you have gamma brain waves, which I think we talk about on another time, but they have a completely different pattern. So it's just to say we have different brainwave patterns. Each are conducive to certain states of mind, certain thinking patterns, and different relaxation strategies. But certain brainwave patterns will be very conducive to healing, insights, aha moments. And this is where people have experienced, the mystical
Euphoria.
and So when we're looking at, psychedelic states, they mirror certain brainwave patterns, which you can achieve through breath work, through meditation.
How epic.
It is.
And I think I don't know which brainwave it is which brainwave is it when you're stressed?
Beta.
Beta.
So beta brainwaves are kind of quite fast, and you've got high beta and kind of lower beta. But beta is when I'm alert, I'm thinking, it's the active mind, I'm kind of doing, which is great when I'm like here. But I don't want to be in high beta when I'm about to go to sleep. I want to be, drifting alpha, delta, and when I do my breath work, I want, so we're kind of bobbing and weaving between these brainwave patterns throughout the day.
Because a lot of people are constantly in beta and don't get
because
enough.
of our phones and because of our screens and because of the outside stimulation.
Absolutely.
And so then we can never drop down.
Yeah, I mean, our phones are probably one of the worst things for us because there's a constant context shift.
Yeah.
Every 20 seconds.
Exactly.
Which is super unnatural. Our brains are not wired to do that. And so you're on social media and you're scrolling and it's like looking at different stories, but in 20-second or less than that, sometimes 3-second snippets, and you're making a decision.
Yeah.
You're going, am I going to listen to this? Not really. Next.
Yeah.
Am I going to listen to this one? Yeah, this might interest me. And so you're constantly making decisions, but actually there's only so many decisions you can make in a day before you get decision fatigue.
Yeah.
So one of the worst things to do is go on social media at the beginning of your day, because you're going to take away so much of those decisions that you need to make during the day.
Yeah.
So I actually now don't check my social media during the day.
That's amazing.
I only look at it at night.
Yeah.
And I have a time limit on it because I know what it's doing to my brain.
Yeah.
It's just literally frying it.
And also, if you think about it, when you're waking up, you're in that window of being between the subconscious and the conscious.
Yeah.
You know, so we have a few of these windows of opportunities during the day. So you're kind of drifting, unless you're woken up by like the of an alarm, but you know, you're drifting. So this is the time to just spend time there. Few minutes, and same when you're going to sleep. But if we introduce the phone, then you're putting yourself in beta straight away. Yeah. So there's no, you know, that kind of gentle process, the insights that you want, the clarity, the tapping into your intuition. We have so much untapped wisdom, innate, that already knows within us.
Tell me about intuition.
You know how it's kind of like an inner knowing. Intuition. So we've got different ways of coming to. So with my execs, and I've done some talks on the neuroscience of intuition. I always say this: we have different ways of coming to a decision, right? So you've got logical thinking, which is show you're working, which I would want my accountant to have. You know, this. It's very logical. I show you, it makes sense. And then we have the just knowing. You know, that instinct, the gut feeling that I'm not sure. Yeah. That is not always logical. That tends to be very fast and very kind of, this is it. And that relies on different parts of us. So the science behind intuition, we know that it's coming from a different type of knowledge, a different type of wisdom, and it's also coming from the kind of the gut, the heart, these nerve plexi that we have. So the ideal is that we can tap into logical thinking as well as intuitive thinking. So the more wisdom we accrue, the more we're in tune with that, we are then able to follow that gut instinct that kind of has this inner knowing. I know it sounds a bit woo-woo, but it's so powerful because you're relying on your innate wisdom.
But when we talk about this innate wisdom, is this learned?
It's kind of like a sum of experiences. You know, like it's just.
Is it a sum of your experiences or your mother's experiences?
See, I see it as going generational patterns, and exactly. I see the body as having its own wisdom. Like you don't need to tell your body to you don't need to tell your heart to beat. You don't need to tell your body to breathe. You don't need to tell all the autonomic responses. And we're not saying, can you do this, please? So we rely on that, yet we don't rely on its wisdom. The thing is with intuition, it can be masked by fear. And it can be masked by our stress response. So sometimes we think it's intuition when actually it's not. Yeah. So intuition, it's a super interesting topic. But with intuition, it's really creating the space and starting to just go slow with it. It's like an inner voice that you have that's coming from a grounded central place. I know it's sounding so, but there is neuroscience behind it. And once you start to tap into it, you start to respect it more, you start to trust yourself more, and you start to create internal safety. So you're then not relying on the outside to cause an internal state. So it's really something to explore. It's something that everybody has, and it's hugely powerful. It's hugely powerful.
So when people say trust your gut,
but as long as your gut is working well.
That's it.
That's the thing. So you come back down to, are you in integrity? Yeah. And it can be very small, you know, like, and so things like breath work. So after my breath work session, I will always say, look, you've gone deep. You've gone into the subconscious. You know, we're 10% conscious, aware, and then the rest is all subconscious. So you can't see my dreams and aspirations as I talk. You can't see my habits. You can't see what I truly think, you know? So by starting to go deep and tapping into that, you just open up your world so much and start to release stuff that really doesn't serve you. And so then you can start to kind of, you know, dance between the logical mind, this is when I'll use it, but the intuition, the intuitive thinking. Because if we're talking about burnout, when we are led by intuition, we are at less risk of burnout because we're not having to think. It's a knowing. It's coming from a different place. And also with the mind, remember one thing, what you put in is what comes out. So if I'm putting in the world is a dangerous place, that's gonna affect my whole way of life.
So interesting.
But with intuition, that's different. So allow intuition to just be, but regulate your gut. You know, you start with all these different pieces, and it may seem very overwhelming. It may seem like a lot, but what I always say is, once there's a change in one, it will domino to the other. So it's not as overwhelming as it seems.
Love it. Thank you for joining.
You're very welcome. Thank you.